So today we are going to study median nerve and ulnar nerve in a comparative way. एनाटॉमी के हिस्ट्री में आज तक किसी ने ऐसा सिखाया नहीं जो मैं आज आपको सिखाने जा रहा हूँ. So this side I am going to draw the branches. Firstly, let me just teach you the branches. Then let us, after that we'll talk about the relations. Okay. Branches. Median nerve, the root value is all C5, C6, C7, C8 and T1. Okay. While ulnar nerve, it is C8 and T1. It is arising from the medial cord. This is continuation of the lateral cord. This is continuation. Ulnar nerve is a continuation of medial cord. C8, T1 and also C7 joins in. In axilla, they do not supply any muscles. Last bench was some bulga. You are not attentive. Huh? Okay. Axilla, they don't supply any muscle. Arm also, they do not supply any muscle. Now coming to forearm. What happens in forearm is median nerve. I am drawing this as superficial compartment, this as deep compartment. This as superficial compartment, this as deep compartment. The median nerve in the arm, in the forearm we studied na muscles like this, 5 muscles. उसमें से 4 muscles are supplied by the median nerve. Pronator teres, flexor carpi radialis, palmaris longus and flexor digitorum superficialis. That means all the superficial muscles of the forearm except for flexor carpi ulnaris. For the deep muscles, ठाकरे कुठे हाँ खोलना होता है. आता थोड्या वेळाने तर माझ्याजवळ वेळ कमी आहे. मी नाही तर नॉर्मली नाही क्लासरूम मधनच फोन लावतो लाऊडस्पीकरवर. For deep muscle it gives a branch called as anterior interosseous nerve. Oh, radial nerve gives posterior interosseous nerve and median nerve gives anterior interosseous nerve, which supplies the deep muscles of the forearm anteriorly. It will supply 3 muscles: flexor pollicis longus, the lateral half of flexor digitorum profundus, and pronator quadratus. That means the ulnar nerve in the deep compartment, Dr. Patel, will only supply medial half of flexor digitorum profundus. Okay. Then comes the flexor retinaculum. Median nerve passes below the flexor retinaculum to reach the hand, which is called as carpal tunnel, while ulnar nerve passes above the flexor retinaculum. Okay? When they reach the hand, ulnar nerve is going to supply 15 muscles over here and remaining 5 muscles. There are 20 muscles in hand. 15 will be supplied by ulnar, 5 will be supplied by median. But skin, cutaneous supply of lateral 3.5 digits. Lateral 3.5 digits will be by median. So median is more cutaneous, less muscular in hand. Ulnar is more muscular supply and less cutaneous. So let's talk about the cutaneous supply first. So cutaneous supply Ulnar supplies medial 1.5 digits. Medial 1.5 digits, while the median now supplies lateral 3.5 digits. 3.5 digits मतलब thumb के दोनों sides, इंडेक्स फिंगर के दोनों साइड, मिडिल फिंगर के दोनों साइड, और इसका केवल lateral half. While ulnar will supply little finger and medial half of ring finger. समझे? Okay. Now the muscles. Muscles में ulnar का बहुत easy है, याद रखना. 4 palmar interosseous, 4 dorsal interosseous, 4 hypothenar muscles, lumbricals 2 lumbricals, number 3 and 4 उनका, and 1 thenar ने one muscle of the thumb, adductor pollicis, adductor pollicis, adductor pollicis. Okay. Now going to the median nerve. Of the thenar muscles, it supplies 3. Abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, and lumbrical. थांबा तुम्ही बोलू नका, थांबा त्या पिक्चर आमच्या भाजेकर हॉस्टेलच्या पोरांना डिप्रेशन येईल. हा उद्या lumbricals 1 and 2, so 2 lumbricals, median nerve 2 lumbricals, ulnar nerve 2 lumbricals. Okay. Median nerve 3 thenar plus 2 lumbricals, 5. Today, if you don't remember after my lecture, that is fine. It's okay, no problem. जितना समझ रहा है, that is okay, because it's very difficult for anybody to remember so many things. You have time. 1 साल है आपके एग्जाम, टेंशन मत. So this is about the supply, comparative supply of median nerve and ulnar nerve. Let us talk about their course. Let us talk about the course of median nerve and ulnar nerve. Median nerve and ulnar nerve. डायग्राम्स ड्रॉ करने का टेंशन मत लो. हमारे नेक्स्ट प्रोफेसर यहाँ पे बैठे हुए हैं, वो आपको 5 मिनट देंगे डायग्राम ड्रॉ करने के लिए. यहाँ पे कॉन्सेंट्रेट करो. ओके. This is median nerve is a continuation of lateral cord. Lateral cord. Rather, lateral cord plus lateral cord का lateral root of median root of median root of median and lateral root of median. So it is formed by the union of medial root of median and lateral cord का lateral root of median. Medial root of median का रूट वैल्यू है C8 T1 और इसका है C5 C6 C7. इसके लिए इसका रूट वैल्यू है C5 to T1. After formation, it runs in axilla. Ulnar nerve is continuation of the medial cord and its course is also in axilla. Its course is also in axilla. So now, so course runs in axilla. So for axilla we have a common diagram, right? Pectoralis major, teres major, latissimus dorsi, axillary artery, coracobrachialis, vein and 3 nerves. So ulnar nerve will be here and median nerve will be here. ये डायग्राम में दोनों कवर हो जाएंगे. कशाला रेडियल नर्व पाहिजे. Radial nerve will be here. So that's the course in the axilla. Then it goes to the arm. From axilla, this goes to the arm. This also goes to the arm. Now what happens in the arm? Median nerve के बारे में, arm में there are two things happening. This is brachial artery. Median nerve crosses it from lateral to medial side. Lateral to medial. वो lateral पे रहता है, तो वहां से वो इसके लिए when in the cubital fossa, so in the arm, it is like this, and then in the cubital fossa, we see the medial nerve. ये cubital fossa ऐसा है. We see the median nerve most medial. Then we see the brachial artery. Then we see the biceps brachii tendon. And then we see the radial nerve. So most medial structure in cubital fossa. तो ऐसे हो जाता है वो. इसको मैं कनेक्ट ही कर देता हूँ ऐसे. So in upper part of the arm, medial nerve is lateral. In lower part of the arm and cubital fossa it is medial. Okay. Now what happens to ulnar nerve in arm? Ulnar nerve is on the medial side. Okay. Suppose ये medial side पे ulnar nerve है, and suddenly in middle of the arm it goes to the posterior compartment. सडनली पोस्टीरियर कंपार्टमेंट में चला जाता है. नाराज होता है उसका मीडियन नर्व. ये आ गया, ये मीडियन साइड पे आ गया, मेरे को नहीं रहने के. एंड इट गोज बिहाइंड द मीडियल एपिकॉन्डाइल. गोज बिहाइंड द मीडियल एपिकॉन्डाइल. गोज बिहाइंड द मीडियल एपिकॉन्डाइल. हाँ, करंट लगा कि नहीं? ऐसा कभी लगा? मीडियल एपिकॉन्डाइल के बिहाइंड आपको फील भी होता है वो टिकलिंग सेंसेशन. दैट इज अल्नार. ओके, अल्नार. सो दिस इन द आर्म goes in the middle of the arm. In the middle of the arm it goes to the posterior compartment. In the middle of the arm it goes to the posterior compartment, then goes behind the medial epicondyle. Goes behind the medial epicondyle. This goes to cubital fossa. This passes through cubital tunnel. What is cubital tunnel? Between the two heads of flexor carpi ulnaris. There are two heads of flexor carpi ulnaris. Flexor carpi ulnaris यहाँ से origin लेगा ना, all common flexor origin. वहाँ पे एक दूसरा हेड भी होता है, वो दोनों के बीच में से वो passing between the cubital tunnel, it enters the forearm. It enters the forearm. Forearm में आ गया. This is in the cubital fossa. It leaves the cubital fossa by passing between two heads of pronator teres. This passes between two heads of flexor carpi ulnaris, ulnar nerve. This passes between the two heads of pronator teres and reaches forearm. दोनों forearm में आ गए. Median nerve arm में lateral to medial, then cubital fossa में medial most structures, leaves cubital fossa by passing between two heads of pronator teres. Ulnar nerve behind medial epicondyle between two heads of flexor carpi ulnaris reaches forearm. In forearm, both of them lie between flexor digitorum superficialis anteriorly and flexor digitorum profundus posteriorly. Okay, flexor digitorum superficialis anteriorly and flexor digitorum profundus posteriorly. बस, we are coming towards the end of this now. जब नीचे लोअर फोरआर्म में क्या होता है, लोअर फोरआर्म में आई ड्रॉ अ कॉमन डायग्राम. On the lateral side is flexor carpi radialis. Then is flexor digitorum superficialis. Then is flexor carpi ulnaris. तो लोअर फोरआर्म में है हम लोग. ओके, कौन से साइड का है? इस साइड का. रेडियलिस, अल्नारिस, बीच में सुपरफिशियलिस. रेडियल nerve will lie here. Ulnar nerve will lie here. Radial nerve lies between flexor carpi radialis and superficialis. So radialis is on lateral side, superficialis is on medial side. Ulnar nerve lies, so this is lateral side, this is medial side. Ulnar nerve lies with flexor carpi ulnaris on the medial side, flexor digitorum superficialis on its lateral side. काय झालं? Sorry, medial nerve. I'm so sorry, medial nerve. Radialis. Okay, medial nerve. Okay. After that, ulnar nerve passes over the flexor retinaculum, and enters the hand, and in the hand divides into a superficial and deep branch. While the median nerve passes below the flexor retinaculum, which is also called as carpal tunnel syndrome, and enters the hand. ओके, चलो 2 मिनट आपको देता हूँ ये नोट डाउन करने के लिए.